Our next speaker is Dr. Scott Hanson-Easey. Did I say it right?
Yep, close enough.
Dr. Scott, he's a social psychologist in the School of Public Health at the University of Adelaide. His current research addresses how information about natural environmental hazards such as heat waves and bushfires are communicated to and understood by the lay public. He's also interested in how risk communication efforts could better address cultural, social... I'm sorry, guys, I've just finished night shift. My brain is not working at all today. I haven't slept for a while. His work utilizes a community-based, particularly research on paradigm to co-design risk and emergency messages with former refugee communities across Australia. He's currently working with Country Fire Authority, CFA, and the Karen communities, which are former refugees from Burma, in Victoria, to develop a film on fire bans and restrictions. Dr. Scott? Thank you.
Thank you, and I can always be fairly confident that I can get a positive introduction when I've written it myself, so thanks, Maha. Firstly, I should thank the organisers for their very kind and generous invitation for me to speak today. Also should recognise the Natural Disaster Resilience Program and the South Australian Fire and Emergency Commission and the Attorney General's Department, who originally funded some research we did in Adelaide in South Australia about 4 years ago, which has actually been formative in developing this kind of research program that I'm still working on. And also with this, also like to thank the CFA with their ongoing work with me at the moment, and the Nil Learning Centre and the Nil Karen community. So my action research generally explores how refugee communities understand and make sense of preparatory and emergency risk communication. So how they actually perceive and make sense, and how it could be improved, and how emergency management agencies could improve their way of engaging and designing messages specifically for particular communities. So this talk is kind of in two parts. One is just performing or telling you about a bit of a rationale or the evidence base for why we are using the community-based participatory approach, because I think theory is important, evidence is important to drive the way we work with communities. And the second part will just be explaining a little bit about the project that we're doing in NIL, which is using that paradigm. So how do I change slides here? Is it just, do I have to? Okay, can everyone kind of see that? This is, I give thanks to Professor Martha Augustinos for borrowing this from her book. It's her interpretation of one of Lunig's non-anti-vax cartoons, thankfully. So in this cartoon you can see the man, and we can assume he is a man, looking down upon the crowds, the hordes, with his understandoscope. And they're going about their daily actions, and you can see a plane. It's actually drawn before 9/11, so it's kind of prophetic in some ways. So Augustinos makes the really great point that talking about, and especially when talking about social psychology is where I came from, that gaining insight into other people's thinking and other people's behaviour is essentially fraught. It's difficult. And it's a problem of subjectivity, and I'll try to make sense of that in a minute. So the problem kind of lies thus. Our attempts to understand other people in their communities from the outside are always framed by our own culture. And whatever version of the understandoscope, the technique or the tool that we're using to gain insight into other communities, to social problems and so forth. So we use surveys, guesstimates, assumptions, intuition, expertise, experience and perceived status, and we try to make sense of what's going on in the social world. So we can say that the man looking through his understandoscope there, looking down the crowd, does not, and really cannot in any way, objectively see what's going on in that crowd and make sense of it. Because his view is obscured by his own culture, his political worldview, which forces him to see through a kind of lens that's really unfocused and opaque. His understandoscope really just isn't up to the job of understanding what's going on in the social world. So there's no real way for any of us to get around wearing these lenses that we carry around with us to make sense of other people and communities. But we can use evidence-based methodologies that help us overcome some of these challenges of intercultural communication. So what's this got to do with designing messages for former refugee groups? Well, Augustinos' interpretation of the cartoon tells us something about how we might go about engaging and designing risk messages with refugee groups and communities. And I think it also says something about how many of us and many agencies use fact sheets as the main way of communicating key messages about risks and hazards and responses. So to meet the communication needs of non-English speaking groups, fact sheets are kind of used and sometimes directly translated from English into the first language of the target audience or the audience. And sometimes using simplified language, and they sometimes use cartoon-like drawings which exemplify behaviours that are being promoted or kind of discouraged. So now I should say really there's nothing wrong with fact sheets, there's nothing inherently wrong with fact sheets, but in some cases when the problem is with their design and how they're informed. And when they're not informed by communities, they can be critically problematic. So one of the other chief problems with fact sheets and other directly translated materials relates to language and its relationship to meaning. So, and I get a bit theoretical here, so Maha, if you want to pepper spray me at any point, that's cool, just to stop me from... Oh, it's a shame, I was kind of looking forward to that. Now, when I say language, I'm really talking about the idea of linguistic relativity, which is the last kind of tricky, kind of weird phrase I'll use. So it's a fancy term, but basically proposes that different languages and cultures apply different meanings to words, even if they can be roughly translatable from English and vice versa. Some languages simply don't have a word or adequately describes a concept in another language. And if they do, these concepts are complex or less complex or more or less nuanced. They just don't translate very well. So the point I'm really trying to make is that here is that the world's languages are relative and they do not universally communicate the same messages to all of us. So the key upshot is that different languages guide us in different ways when making sense of our world and how we respond to it. So different languages frame different communities' perceptions of the world, its risks, and the values associated with hazards, risk and risk-taking as well. So many Australians come from very many different cultures, which is one of the great strengths of Australian society, and newer Australians have yet to build experience as well and develop language around the new environment they're in. So, and this is particularly problematic in emergency contexts. So, moreover, our experiences of the world compels us to learn language and concepts in order to make sense of it and communicate it effectively with others. So, because I'm a social psychologist, I can't really help but give theory or use theory to try to make sense of these challenges. So, and get a better kind of grasp on how it works and how it can be overcome. So I like to use a theory called social representations theory by Moscovici. And social representations is a fairly simple kind of idea that a thing, a microphone, lights lighting up the grass out there for the footy players on the weekend, a bushfire, a heatwave, are made up of a stock of ideas, values, beliefs, practices, images, and they're shared in language amongst community members that help us identify and name the object and to work out how to respond to the object. If I'd never seen a microphone before, I wouldn't know that I needed to speak into it. So language helps us guide us and orientate us to the world that we find ourselves in. So social representations give us like a common code or a language for social interaction. So we can discuss, debate things intelligibly or half intelligibly with other people, or help us plan approaches to hazards such as bushfires, floods, heat waves, and other threats such as Donald Trump, that broken toilet of a man. So without access to social representations, partially learnt through experience and social interaction, refugee communities can be sometimes completely lost and disorientated in hazards and emergencies. So this is I think I'll skip that page. I've only got 2 minutes left. All right. You don't have a gun or pepper spray too, so if I go over. All right. So I can use old Ludwig Wittgenstein. Once got told off for saying his name wrong by a really anal kind of philosophy student once. So I've been trying to learn how to say it ever since. I can use old Ludwig's quote here to sum up what I'm trying to say. What he's getting at here is that behaviour and language are intertwined in such a way that our language dictates our nature and our perceptions and experiences of the world, and can apply to how people respond in emergencies and disasters. He also said that when we can't think for ourselves, we can always quote, which is hurtful.
Not your fault.
It's probably Wittgenstein from the grave. All right, so how can we proceed? How can we improve this problem of intercultural communication? Now, I just want to give a brief overview of the community-based participatory approach the CFA, ourselves, the Karen community and the Neil Neighbourhood Centre are using to develop a film that gets the message across about heatwave bans and emergencies and hazard periods. So CBPR emerged from the health communication arena. It works on the premise that if we meaningfully engage minority communities in the design and conceptualisation of messages, this increases the interpretability and relevance of the message for that group. And therefore, the message has a greater chance of influencing behaviour. Core to the process is the idea that the refugee community themselves and community partners and other stakeholders such as EM services contribute and distribute their own unique kind of knowledges and share responsibility and ownership for the project as equally as they can. So really one of the most important things is that the approach champions the role of the refugee community themselves in defining what the risk is for them. What does the risk mean for them? Or the hazard means for them, and how is it affecting them in their daily lives, and what can be done to improve communication about the risk between them and emergency services. So it's also really cognisant of socio-economic and political contexts. You can have all the information in the world, but if you don't have enough money to respond, if you don't have a house that is well insulated enough, then it's very difficult to adapt to the conditions that you find yourselves in. So, as an example, the Karen community, refugee community from Burma, the CFA, Neil Learning Centre and I have been making a film. It's been a long road. It's actually taken about 4 years from the point where we got some funding. And it was really developed on the basis of trust. And that took a while to build between the local stakeholder, the Neil Learning Centre, who had a long and really quite close and intimate relationship with the Karen community, ourselves, the CFA. And I can't really overemphasise the importance of this trust-building phase of the project. So after much consultation with the community, they wanted a film that reflected and communicated what it means, what you can do and what you can't do in fire bans and restriction periods. And it's really confusing, and even in English for me. So they thought a short narrative film would be the best way to get the message across for their community, that should be spoken in their native language of score, and the film's dialogue should be directed by them and should be acted by them. And that's all the time I have, so thank you.
Thank you, Dr. Scott. I agree with my past experience, 10 years in the multicultural communities, language plays a big role. When I came to Australia, I spoke a bit of English, but what made things weird for me was the jargon. So, chakayui, for example. If you try to translate it to Arabic, it doesn't make sense. So, I always tell people, be careful when you don't speak jargon, and especially to new arrivals, because they will translate it, it doesn't make sense in their head.